Hello everyone, welcome to the Voice of Homeopathy. Today I will discuss some of my few clinical cases with you, very short ones. And in the recent past I have published some videos on my channel about the role of family history, role of personal history, role of convalescence, what to do when selected remedy fails, and some these type of concepts are to be undertaken during the prescribing. Now I'll discuss some of my few clinical cases, and I have also I have also discussed about many types of syndromes, different types of syndromes, and what we can do in those syndromes, how we can select remedy with very less symptoms. So today in our clinical cases, first cases, two cases are of umbilical hernia. Now, umbilical hernia is a condition in which the abdominal wall behind the navel gets very weak, it gets opened up, and which causes the bulging of fat, the greater omentum, and some bowels. In the conventional treatment, the main treatment is the surgery, either by stitching the abdominal wall or by applying a meshwork in there. So, the first case is of umbilical hernia. 2-month-old baby. Only few symptoms we have is the umbilical hernia, constipation, and irritability. Lot of irritability in the child. And on just upon these two symptoms, because a 2-month-old baby cannot give much symptoms, we have to rely on the signs basically, and on our observation. So nux vomica was given, and we got a very good result. So when we open in the repertory, just a moment. When we have umbilical hernia accompanied by constipation, we have two medicines, cocculus and nux vomica. So first to give the nux vomica, and if your nux fails, then it is written in many of our texts, then we should move towards the cocculus. Now the second case I want to discuss is again of umbilical hernia. It was a 1-month-old baby and no symptoms, basically only clinical sign, umbilical hernia, you can see that. And what I got in the information that it occurred after vaccination. It was not since the birth. The above one was since the birth. This case was since the birth. But this umbilical hernia came after the vaccination. So when we have never well since the vaccination, the main causative symptom is for the thuja here. So after thuja we got beautiful results. I'll show you in photographs after the lecture. And third case is of omphalitis. Now omphalitis is the inflammation and infection of the umbilical cord stump in the newborn babies, neonatals. And this was a case of 15-year-old baby, and the only symptom we got is the inflammation and discharge of some blood and some type of pus type of matter from the umbilicus. The main prescription I got is the ibuprofen. Now when you see umbilical hernia in children and ailments after vaccination, the first medicine comes to the choice is thuja. Salicylac is also coming, but it doesn't cover the umbilical hernia. And in the above case, we have two medicines, umbilical hernia with constipation, we have cocculus. Always think of, when you got umbilical hernia case, think of nux moscata, cocculus, plumbum, and thuja. Never miss these remedies. Always probe on them. Now I also want to tell you about some rubrics in the NER repertory. When you have umbilical hernia with colic in a screaming infant screams like chamomilla. Okay, so that in that patient, that child, we have colic and umbilical hernia. Think of the medicine Castoreum canadensis. And in the second I got the rubric, that is incarcerated umbilical hernia, means the you can easily palpate the bowels in them, incarcerated with bowel. And with that we have a vomiting of fecal type of matter. Think of the medicine opium here. Now for the fourth case of the omphalitis, the inflammation of umbilicus, we will choose the rubric in children, and discharge from umbilicus, and the main medicine we got here is abrotanum and calcarea phos. Well, I have chosen abrotanum because I have verified it clinically many times in my practice. Now I'll show you some of the photographs. This was the nux vomica child. You can see the first picture. See here, this one is umbilical hernia, and again we have series of picture. Now, after nux, it just like you have deflated some balloon or something, and by the time constipation relieved, irritability relieved, and the hernia also goes back and recedes in, and child became normal within, I think, 3 or 4 weeks maybe. Now the next case, this one was of Thuja case, which was occurred after the vaccination. See this type of such severe kind of hernia, and it was almost like an, I can say, more than a size of walnut. I can say more than a walnut in a small baby. This was the first epic, and then as I gave Thuja, after that Thuja is suddenly deflates. When I palpated it in the first time, I could almost feel the movement of bowels in them. This was after the Thuja, and it deflated. By the time, some more pics after that, some more, and by the time it gradually recedes in. So from this we reach to this. Now the third case of omphalitis, you can see here, this is the inflammation, and there is discharge of some pus and some bloody fluid, and after abrotanum it improved a bit. Picture is not much clear, but it improved, and after few weeks it again came back to the normal, no discharge of pus, looks like a normal umbilicus. So this is it guys, thank you very much for all the support, and I'd like to give you a good news that in the month of July I am again conducting an online webinar, and just like the last time I have done on the thyroid disorders, again this will be a free webinar on and the topic that I have chosen is that small remedies, rare remedies, and single remedy rubrics. All these years of practice, all the remedies which came in across me, the small remedies, the like cyclamen, small remedies like Glycerigia glabra, rare remedies like castoreum. So these kind of cases I'll share with you in that webinar. I'll almost share the clinical knowledge and the clinical verified cases which I have cured with the rare medicines, and I hope it will make you, it will benefit you a lot, and it will be a benefit to all the homeopaths who will be able to attend it. So stay tuned till July, and thank you all, thank you all, thank you all. Thank you all homeopaths for supporting Voice of Homeopathy so deliberately, and you can write to me about your thoughts on my lectures on any topic you want me to cover, and you can write to me on my mail ID devin.071986@gmail.com, or you can text me on Messenger or on the Facebook, or you can also comment in the YouTube comment box of the video. So tell me how you liked my lecture and what are your expectations from me in the near future. Thank you all, thanks for support.